The impact of cancer on mortality rate, according to the former Minister of Health, Professor Isaac Adewole, underscores the need for development of effective treatment, improved access to cancer screening and early detection cancer prevention, as well as a strengthened healthcare systems to address cancer care disparities. The former minister made this known at the 7th Scientific Conference of Association of Radiation and Clinical Oncologists in Nigeria, ARCON, with the theme Cancer Control in Nigeria, Actions for Impact, held at the International Conference Center, University of Ibadan, Oyo State. Adewole, who was represented by Professor Imran Muson, highlighted the challenges working towards reducing cancer's impact as a leading cause of death, while advocating the need for collaboration at all levels to transform cancer care delivery in Nigeria. He lauded the effort of the federal government in optimizing healthcare delivery in the country, while admonishing the state and local government to also follow his steps. The radiation and the clinical oncologist in Nigeria hinged on the theme Cancer Control in Nigeria, Actions for Impact.
We want to really improve access to cancer. We need to look at the value chain of cancer care, which starts from prevention. If a lot of people have access to good information on how to live a healthy living, a lot of people will be prevented from having risk that will make them develop cancer. Yes, capacity building to the specialists, but capacity building to the frontline health workers. Community health extension workers that are in the remote villages should know about risk factors of cancer and should be able to tell people in their community how to have an healthy living in order to have a reduction in the population of people that will be at risk of developing cancer.
We are looking at various ways to try to, number one, get the patient, the doctors, the young graduates to become interested in our field, and also to see what we can do for those that are remaining behind, how can we lessen the workload? Because we've also looked at it, we've done a couple of studies and had discussions amongst ourselves. Another driving factor why people leave this country is because of the heavy workload. And there's an opportunity by infusing technology to lighten the burden for a season up until the time when these young doctors eventually become specialists and are helpful within the oncology space and taking care of patients with cancer.
As we continue our collective efforts to combat the rising tide of cancer in our nation, and I know it's not only peculiar to our nation, it's throughout the world, this theme underscores our shared commitment to translating research, knowledge, and policy into real-world situations and solutions that will have a measurable impact on cancer care.